This is Mark Rothstein. At the end of my last video, which I recorded on July 20th, 2022, I said I would be willing to provide updates in the future. The future apparently is now, and so only 11 days later, July 31st, 2022, I am providing these updates in response to some requests that have come in. I've been asked to address two issues. First, the decision by LA County not to reimpose an indoor mask mandate, notwithstanding the increase in COVID cases brought about by the BA.5 Omicron subvariant. Second, I was asked to address some questions about monkeypox, several that follow up on my brief discussion of monkeypox last week. I know many of you have already seen one or more of my prior videos, so I won't repeat my various disclaimers, but I will incorporate them by reference, as lawyers like to say. And if you want to review them, you can get a copy of one of my earlier videos and thumb through my disclaimers. So let's move to the first issue, and that is LA County's decision not to impose or reimpose an indoor mask mandate. This is a rather complicated matter of public health policy. And what I'd like to do today is try to go through some of the reasoning that public health officials generally use in making these kinds of difficult decisions. The science surrounding the issue of masks and the pandemic, it's pretty well established. As I mentioned last week, the BA.5 subvariant is extremely contagious. Let me say that on a personal level, several of my friends and professional colleagues who are physicians or public health experts have become infected themselves in the last few weeks and months. And I know they have been extraordinarily vigilant with social distancing, masking, vaccinations, boosters, the whole 9 yards of prevention. They were just unlucky recently to be exposed, and they think this was mostly from contact with family members who had been exposed. So it's important for individuals to wear a mask if they are spending more than a fleeting amount of time in an indoor setting, especially where there are groups of people close together. Two-way mask wearing using an effective mask, that would be an N95 or KN95, is highly protective. One-way mask wearing is also valuable in protecting the wearer, but to a lesser extent, because without all people in the area wearing masks, you have to assume there will be some level of airborne COVID exposure that might not be filtered by the individual's mask. LA County said that indoor mask wearing is, quote, highly recommended, unquote, but not mandated. So why did they adopt that position? The public health policy question, I think, is whether the rate of compliance would be higher with a mandate than with only a recommendation, and if so, at what cost? Arguments in favor of a mandate include that a mandate conveys the sense of urgency of the situation, and this might be enough to get some people to be more vigilant in wearing masks. Other people might comply because they fear the legal consequences of failing to comply with a mandate. If mandated, many people might be required to wear a mask by an employer or a school or some other entity. And still others might feel wearing a mask will be more socially acceptable if everyone has to comply with a mandate. On the other hand, mask mandates, and I would say mandates of all kinds, continue to be unpopular. The cities of Beverly Hills, Long Beach, El Segundo, and Pasadena already said they would not comply with a mandate by LA County. Even if the city governments complied, what about individuals? Clearly, there would be legal challenges and widespread opposition. Many people would wear ineffective cloth masks, wear them only sporadically, or wear them improperly. And who would enforce the mandate? Store clerks, waiters, and other frontline employees are unlikely to be eager or effective enforcers. And attempts to get compliance by customers or the public could cause a backlash, as we saw with the federal mask mandate on airplanes. What about the possible effects on public health compliance in general of having this mandate? One public health official who was not from LA said that public health officials can't be in the position of constantly crying wolf. The reasoning is that if a future variant were not only highly contagious, but unlike BA.5, also highly lethal, then people might be so numb to mandates and so opposed to them that they wouldn't comply with even such a more essential mandate. Public health is contentious and controversial because it often presents a conflict between the interests of the individual and the interests of society. For example, quarantine involves the restriction of movement of currently healthy people because they might have been exposed to a communicable disease, and therefore they could infect others even before they became symptomatic. Public health depends on the willingness of individuals to make personal, social, or economic sacrifices for the good of the population. Public health requires social cohesion, trust in physicians and scientists, trust in public health officials, trust in government, and concern for each other, especially for the most vulnerable members of society, including individuals who are at increased health risks. As we all know, the US lacks social cohesion now, and the consequences have been exposed tragically during the pandemic in the unnecessary deaths of hundreds of thousands of people who refuse to become vaccinated or who refuse to comply with other essential public health measures. I hope this helps to provide some perspective on why public health officials in LA and elsewhere have a dilemma with regard to reimposing mask mandates. It's not surprising that some of these officials made decisions that do not align with optimum public health science. I'm not saying the decision in LA County was right or that I endorse it, only that I understand the probable reasoning behind some of the decisions involving mask mandates. Now on to monkeypox. I have been asked to go over some of the basics of monkeypox I discussed in my video last week, as well as to provide some answers to new questions that have been submitted. The World Health Organization has declared that monkeypox is a worldwide health emergency. So far, it has infected over 20,000 people in 75 countries, including nearly 5,000 cases in the US. On Thursday, July 28th, New York State and San Francisco declared monkeypox a public health emergency. The federal government has not yet declared monkeypox to be a public health emergency. Monkeypox gets its name because it was first discovered in monkeys, but the source of the disease is not well known. It originated in Central and West Africa. It is a type of variola virus related to smallpox, but not chickenpox, which is caused by the varicella virus. Symptoms of monkeypox include fever, headache, muscle aches, swollen lymph nodes, etc. These are symptoms common to many illnesses, but the one characteristic symptom is the pox, a rash that can look like pimples or blisters and appear on any part of the body. It is spread from person to person through direct contact with the rash, scabs that form on the rash, or body fluids. It also can be spread through respiratory secretions, close contact, including sexual contact, and fomites. Here it is important to disinfect surfaces and clothing. The illness lasts 2 to 4 weeks, and it's reported to be very painful. The fatality rate is 1 to 10%, depending on the strain of monkeypox. In the US, over 99% of the people infected thus far are men who acquired the virus through intimate contact with men. Only 13 women and 2 young children had been diagnosed with monkeypox as of July 25th. As discussed on my last video, monkeypox is spread through intimate physical contact, including through respiratory droplets and fomites. The instructions for disinfecting homes, cars, and other surfaces are quite detailed and appear on the CDC website, which is cdc.gov. Unlike COVID, there is no evidence that monkeypox can be transmitted by asymptomatic individuals. And that's good news, because if infected people are very careful, they can help slow the spread of disease. Unfortunately, monkeypox can be transmitted to pets, and people who have been diagnosed with monkeypox need to take steps to protect their pets. For these details, please check the CDC website, and it goes through how to protect your pets from getting monkeypox. Some people have asked about the monkeypox vaccine, which is called Jynneos. It's spelled Jynneos, Jynneos, but pronounced Jynneos. The vaccine is manufactured in Denmark and distributed by the US government to the states. So far, about 320,000 doses have been delivered, with another 800,000 doses scheduled for shipment right away. At-risk people, including workers in healthcare facilities, lab workers, and public health workers, have been given priority for vaccination. Home healthcare workers and personal service workers, such as barbers, beauticians, and nail salon workers, also are at risk and should also be given priority. The monkeypox vaccine is given in 2 doses, 28 days apart, although in some countries with limited supplies, they have opted to give only 1 dose, and it seems to have protective value. The vaccine is safe for people who are immunocompromised. That is the monkeypox specific vaccine, Jynneos. But some of them might not have a robust antibody response. The ACAM 2000 is a smallpox vaccine that has been shown to be 85% effective in preventing monkeypox. And it has been used in many places to supplement supply shortages of the Jynneos vaccine. But certain groups of people, including those with serious immune system problems, can have severe complications with this vaccine. So please check with your doctor before taking the smallpox vaccine to prevent monkeypox. Since it was first observed in 1958, the sporadic outbreaks of monkeypox in Africa have not been limited to any particular segment of the population. The current outbreak in the US and elsewhere is also unlikely to be limited to certain population groups, and we should prepare for population-wide education, prevention, vaccination, diagnosis, and treatment. Unfortunately, the same societal obstacles to public health interventions for COVID that I discussed earlier are also likely to create challenges in efforts to deal with monkeypox. So this concludes my latest depressing update. Thank you for your questions, the kind messages, and encouragement to produce these videos. I hope they provide you with some valuable information. Please stay well.